Hi, and today we're here with Dr. Kamboh with Lansdowne Dental Associates. We're here to talk about sleep apnea. So, Dr. Kamboh, not everyone is aware that dental professionals treat sleep apnea. So, can you give an overview? What are some of the symptoms of sleep apnea? How do you approach it with your patients, and how do you provide treatment options?
Great question, Rob. So just start with sleep apnea itself. Sleep apnea is a sleep-related breathing disorder. What that means is people can either stop breathing when they're sleeping, or they can have a decrease in oxygen in their blood as a result of an obstructed airway. Okay, the decreases in oxygen can cause issues with your heart, with your brain, can increase blood pressure, and just cause a lot of secondary just problems medically. So how someone is diagnosed, I know people have been, I hear constantly from patients is, oh, my husband snores, or even my wife snores really loud, with or without a cocktail. Some people will actually see their spouse stop breathing, which can be a very scary thing when you're with someone and they just stop breathing for a period of time. And that happens pretty regularly. And so when we have these discussions, we open it up, and I figure out if the patient has had a sleep test first. And if they've gone to their primary care and had a sleep test, or gone to a sleep doctor, or even thought about that. When you see signs of grinding their teeth, high blood pressure, larger neck circumference, larger tongue, these are all things that could be potential signs. And then you ask, do you snore? Snoring does not necessarily mean you do have sleep apnea, but it could be a symptom of a sleep-related breathing disorder. So we refer them to a sleep specialist to get a sleep study done. Based on the results, on the severity of the apnea, if you have mild, moderate, or severe apnea, the treatments differ. The CPAP is the mask that everyone has seen, mask with a tube, can be uncomfortable to sleep with. Yeah, it's all over, and they have big ones, small ones. They do make noise. They have to be cleaned. Can be uncomfortable, cumbersome, hard to travel with. But it is the first line of defense. And CPAP, it treats sleep apnea extremely well. It is very, very effective. The compliance is not always there. As a dental professional, we can actually make something called an oral appliance to help treat mild to moderate sleep apnea. So what an oral appliance is basically an upper and a lower guard with a hinge that helps to bring the lower jaw forward. It'll drop the floor of the mouth, open up the airway, and allow people to breathe better. It can decrease the snoring too. That is a good side effect. Spouses and partners and everybody are very happy with that. So sometimes it brings couples back into the same room.
Got it. All right. Well, that's very informative for those who are experiencing potential sleep apnea and also want great dental care. We encourage you to reach out to Dr. Kamboh at Lansdowne Dental Associates. So thanks for your overview of sleep apnea and the treatment you provide. Appreciate your time.
Thanks, Rob.
Take care.